The new paradigm in medicine currently is anti-aging. One of the products that they have identified that seems to be important at the level of multiple different areas is NAD. And NAD currently exists as a supplement, both oral as well as injection. And there are some studies now that shows that supplementing, especially as we get older, the NAD level does help with multiple different areas, such as weight loss, anti-aging, more energy, and better sleep. NAD IV therapy goes directly into the bloodstream and therefore bypasses our digestive system. Sometimes when we take NAD in an oral form, it doesn't fully get absorbed. And therefore, supplementing through an IV method seems to be much more effective. We at Wave are currently offering NAD IV therapy as an adjunct to our anti-aging treatment. And the feedback has been very positive in that patients do feel better, they do feel more energetic, have better quality sleep, and have more focus. NAD certainly exists in our natural state and is an essential component to our health. And as we get older, it does decrease, and therefore supplementing that seems to be quite effective.
Hey there, welcome back to our channel. I'm Steven, and today we're going to do a deep dive into the latest and greatest in rejuvenation and wellness. So today we're going to unpack a little bit of a hot topic that's been buzzing around, the NAD Plus IV therapy or NAD IV therapy, and how to nail down the right dosage for you. But before we jump into the dosage and details, let's first talk about where we get our NAD Plus from, because not all sources are created equal. So here at Wave, we're all about quality and safety for our patients, which is why we only source our NAD from 503B compounding pharmacies. What is this? So there are only a handful of FDA registered 503B compounding pharmacies across the whole country, aiming to ensure the safest and most effective medications with the best results for patients. When it comes to criteria, they have a strict protocol. These facilities follow current good manufacturing practices, have licensed pharmacists supervising the compounding, and are inspected by the FDA very regularly. Plus, very transparent in terms of providing lists of all products compounded and the source of their ingredients every 6 months, not to mention keeping track of any adverse events. So now let's talk about dosage. The ideal dosage for our patients is typically 100 milligrams. This isn't just any NAD IV, it's high purity NAD Plus from a 503B pharmacy, so we respect its potency. 100 milligram dosage takes about 1 hour to infuse into your system, nice and easy. Rush it and you might feel a little side effects nobody really likes, like palpitations or dizziness. If you want more than the recommended dosage, again, because of its purity, we take about 3 to 4 hours to complete a 250 milligram injection, or 6 to 8 hours to complete a 500 milligrams injection, depending on your weight and height. But remember, because of its purity, we take our time to ensure it's a smooth sail for both you, and on average, 100 milligrams is a good dosage for best absorption. So the ideal frequency for a NAD IV is about getting weekly infusions for 6 consecutive weeks, then continuing doing it every 2 to 4 weeks to maintain the results. Now, if you're always on the go and can't spare a whole afternoon, don't worry. Here at Wave, we got your back with IM shots or intramuscular. These are perfect for those with a busy schedule. They are lower dosage. They do require less time, but you still get all the benefits of a NAD Plus therapy. Plus, alternating between IV and IM is not just time effective, it can also maybe give your veins a little break from the IV sessions. So remember, whether you're looking to dive into the details of IV therapy or just curious about how it all works, we're here for you. At Wave Plastic Surgery, your safety, schedule, wellness, and skin rejuvenation are our top priorities. As always, if you've enjoyed learning a little bit more about NAD IV therapy, give this video a thumbs up and tap that bell to be notified when we post. Hi everyone. Today let's talk about 2 players that got a lot of attention recently in the world of wellness and anti-aging, and that's NAD Plus and NMN supplements. It's kind of like comparing a direct flight with a connecting flight. Both have same destinations, but one is much more direct and efficient. So first is the NAD Plus. Now we've discussed this topic multiple times already. If you'd like to learn more about it in detail and in depth, we'll have the link here. But in short, NAD Plus IV therapy is like the direct flight. It's a coenzyme that's crucial to our body for energy production and cellular repair. And as we age, our NAD Plus level drops and leads to a whole bunch of aging issues. That's where NAD Plus IV therapy comes in. It's directly replenishes your body's NAD levels. It's fast and efficient, kind of like getting a direct boost of energy and cell support. Now on the other side, we have NMN, short for nicotinamide mononucleotide. NMN is a precursor to NAD+. It's the ingredients needed to make the final product. When you take NMN supplements, you're essentially giving your body the parts it needs to make NAD+, which is, using my analogy before, is a bit like taking a connecting flight. You are heading towards the same destination, which is the increased NAD+ levels, but it takes longer and the journey is more indirect. This is where NAD+ IV therapy gets the nod. It's all about immediacy and efficiency. With NAD+ IV therapy, the coenzyme is directly and immediately available to your cells. This means faster and more noticeable results in terms of increased energy, better mental clarity, and the overall cellular health. On the other hand, NMN has to go through the digestive system and can be converted into NAD+ by your body. It's a slower process, and not all of it might get to its final stage. This doesn't mean that NMN isn't beneficial, it's just a more gradual approach to achieve the same goal. So if you're looking for a more immediate and potent way to boost your NAD+ levels, NAD+ IV therapy is the way to go. In the end, the choice is yours. Just know that in the race to maintain youthfulness and vitality, NAD+ IV therapy could give you that direct, efficient edge you're looking for. If you enjoyed today's video, click on that like button, and if you have any more questions about these two supplements, leave your questions in the comments below. I'd be happy to answer them. Hi everyone, my name is Steven from Wave Plastic Surgery. Today we're going to talk about the NAD+. So the NAD should always arrive in its powdered form because it's the only way to keep it active and stable. Keep in mind, 503B compounding pharmacies that make this form is the only FDA regulated source for NAD+. So right now I'm just gonna kind of show you guys how I would take the medication and infuse it into the IV bag. And one of the things that you guys should know, that let's say you don't have enough time to sit and take this infusion rate, which takes about an hour. We have other means of getting the medication into your system, which is through an IM injection shot, which is gonna be through your muscle. So if you wanna one day come and do the IV infusion, or in the next week, if you don't have time, do an IM injection, you can do that if it's more accommodating to your busy schedules. And for some patients that would add some extra IV nutritional benefits, you could always add the vitamin B complex. But most importantly, whichever route that you do decide, the results are the same. Hello everyone, welcome back to our channel. I'm Steven from Wave Plastic Surgery, and today we have an exciting Q&A session about NAD+ therapy. We've gathered some of the most frequently asked questions, so let's dive right in. Isn't NAD too large to be absorbed directly by the body? It is true that NAD Plus is a relatively large molecule, but it's certainly not unique in that respect. Many molecules involved in human metabolism, particularly enzymes, are as large or larger than NAD Plus. Recent studies have shown that IV delivered NAD Plus can increase mammalian cell function and neuron communication. NAD Plus molecules likely enter cells through gated channels in the cell membrane, though there's ongoing debate whether the intact NAD Plus molecule or its smaller constituent molecules are transported. So the question is, I am trying to find out whether or not I should take the supplement or do the IV. Can you explain the big difference? We prefer intravenous delivery because oral supplements of NAD Plus are rapidly degraded by the intestinal flora and the liver enzymes. So intravenous administration is the most efficient and effective route to rapidly raise and maintain intercellular NAD Plus concentrations, providing quicker and more noticeable benefits. Is NAD Plus pregnancy safe? There's evolving research in animals suggesting that supplementing NAD Plus levels in utero may improve fetal growth and reduce birth defects. Some clinics in Europe and Asia advocate for low levels of NAD Plus during pregnancy. However, the pharmacokinetics of NAD Plus transport across the placenta in humans aren't well understood. Therefore, we currently do not recommend intravenous NAD Plus administration for pregnant women. Is the recommended dosage 100 milligrams per week the same for IM as it is for IV? No. The recommended dosage of 100 milligrams per week is specifically for the intravenous IV administration. The dosage and method of administration can vary significantly between IM and IV, as IV is more efficient for rapidly raising NAD Plus levels. What dose do you give intramuscular? The dose for intramuscular or IM administration of NAD Plus can vary based on individual needs, but we typically administer a dose that's carefully calibrated to each patient's specific requirements. But for more detailed information, it's best to consult directly and call our call center number, which will be provided in the description below. How long does NAD Plus remain in the system after a drip? The effects of intravenous administration of NAD Plus can last up to 14 days, depending on the dose administered and the patient's age, size, and health status. Do we need to take this every week or every month? The frequency of NAD Plus infusions can vary based on individual needs and goals. Some patients may require weekly infusions initially, while others may switch to monthly maintenance doses once optimal NAD levels are achieved. It's best to discuss a personalized plan with our medical team. Thank you so much for watching. We hope this Q&A session has answered all of your questions about NAD Plus therapy. If you have any more questions, feel free to leave them in the comments below. Don't forget to like, subscribe, and hit that notification bell so you don't miss out on any of our future videos. See you next time.